I'm a medical herbalist working with Grass Roots Remedies cooperative. And our aim is to try and make herbalism as accessible and inclusive and ecologically responsible as possible.
We work together to deliver herbal remedy workshops in communities and deliver herbal medicine into communities. We aim to do that in areas of multiple deprivation. In the communities that we work in, people have really low levels of good mental health and good physical health.
The biggest determinant of health outcomes in society today has nothing to do with what you eat or drink or your lifestyle choices. It's entirely related to your socio-economic status. We run as many free workshops as we can, teaching people the skills to grow their own medicine or forage medicine from the wild, and then have the knowledge to turn it into medicine to use at home themselves with their families.
We run the Wester Hales Community Herbal Clinic. You could go see a medical herbalist and come away with some medicine that has been grown by the community in this community.
I'm having trouble sleeping.
We could start with quite mild herbs that are really calming and just help your body calm down. Does that sound
And that clinic is offered by donation, intentionally so that it can be accessed by people who wouldn't otherwise be able to afford private healthcare, which is what herbalism is today. There's volunteers who are growing medicinal herbs for this clinic in their own gardens or on their allotments or in the community garden, and then they would grow the herb themselves and let us know at the time when it was ready to harvest. So the idea with all of our work is that people are as involved in the process as possible. So we would understand that healing really has to come from within.
What we all need to do is engage in the idea that it's not a one-fits-all type of medicine we're after, and actually herbs can deal with a lot of the chronic conditions over a longer period, and they don't have the same side effects as standard medicines do.
And then our relationship with the health agency is a very kind of patient-centred, collaborative one. They form the reception of our clinic, they refer patients to us, and we refer patients back to them.
One of the things that really interests me about Grassroots is how they can help our patients in a very conventional sort of way. So medical herbalism can replicate a lot of the things that we do with medicines, but they can help our patients see their health problems in a much wider context. We have a long history in Wester Hales of issues around deprivation and long-term unemployment and poor health outcomes. We recognise that you have to approach those problems differently.
We've seen a real growth in certain people who initially would be what you would class as hard to reach. We might be the first service that they have engaged with at all, and now are really actively involved in the community and attending all different types of community events.
We also run the community project, which is actually mostly in this community garden, the Colders Community Garden, and we make lots of herbal teas together, and then we give them out for free to local people.
Remember to like sage, not just copy this old up there and label.
Hold and glue next. Oh, it smells.
So the idea is that people can form a relationship with the plants and with other people.
This place means quite a great deal to me. It's primarily a place where I can connect with like-minded people, and I know that I've got a tendency to sometimes isolate.
They're really taking me to show me new things. I'm willing to try more things. Meeting people that I've seen in the street for years, now I'm like their friend. I would never have met them otherwise. Really helping both my health physically and my mental health, both the gardening and the clinic.
I'm a carer to 2 disabled sons, and one of the things that attracted me was that I'd used herbal medication before, and I found it suited myself and my son better than conventional medication. The project enabled us to get that treatment.
Our ambition would really be to just make sure it can keep going, So we're trying to work as hard as we can to make it sustainable. And to do that, we absolutely will need to rely on people supporting us and providing us with donations, even paying a regular amount monthly.
Often projects start and then unfortunately they're not able to continue because they don't get adequate funding. And I think that this has been an example of being able to access something that's really vital for us.
If I was to imagine it to be gone, then I would feel quite a void for that, because there wouldn't be that whole community and that whole connection. There wouldn't be people facilitating and imparting their knowledge into us. And I don't think it is actually given as much support and acknowledgement as it should be, because it really is like a vital resource in an area of deprivation. There isn't a lot of things out here.
It's allowing people from a community that would never ever ordinarily be able to access a herbal medicine, and we're giving them that chance. And not just that, but the fact that we grow our own herbs as well within the community, and we'll turn those herbs into medicine and give it back to the community. So it's so holistic and it's so incredibly unique and amazing, and I'm proud.